Hello and welcome to Health Matters on Channels Television. It's good to be with you again. I am Mary Alale Yusuf. Cardiopulmonary resuscitation, more often called CPR, involves the heart. The word pulmonary means it also has something to do with the lungs. It is performed on a person to restore and maintain breathing and circulation, and also to provide blood flow, and by implication oxygen, to the heart, the brain, and other vital organs. It is performed on a person who is unconscious and has stopped breathing. CPR can be administered by trained persons or healthcare professionals, but should be done by the person on the scene who has the most experience. My guest is Chinwe Musu. She's a nurse and a certified corporate wellness coach with Heart Matters Services in Lagos. You're welcome to the program, Chinwe.
I'm glad to have you here.
Let me first ask, what kinds of problems can make CPR necessary?
Okay, CPR is useful in any situation that involves unresponsiveness. By unresponsiveness, I mean situations where someone is not able to speak. When you tap the person on the shoulder, she's not responding. And most times they're not breathing. And most times there are no pulse.
Does it mean that sometimes they could be breathing and they still need CPR?
No, if someone is breathing, they don't need CPR. If they're actively breathing, sometimes if someone is gasping, that is not normal breathing. That is most times, a sign of cardiac arrest. Yes, you should go ahead and give CPR.
Okay. Now, I know that, for example, CPR or cardiopulmonary resuscitation is administered when somebody has had a heart attack. What other conditions could bring that up?
Actually, when someone has had a heart attack, they don't really need CPR unless they've gone into a cardiac arrest. Okay, because there are two different things. We can look at heart attack as a plumbing problem. Okay, there is a blood clot blocking the blood vessel. Okay, in that case, the heart muscles are dying. There are symptoms associated with that: pain, shortness of breath, nausea, vomiting. Then the person is still actively breathing. The person may still even be responding. But then when the person eventually goes into full-blown cardiac arrest, the person is not able to talk. The person is not responding. If you shake them and tap them, they're not going to respond to you. So that's two different things. In cardiac arrest, you can look at that as an electrical problem, because that means electrical impulses in the heart is not working. That's why the heart has gone into cardiac arrest. Yes, sometimes heart attack could lead to to cardiac arrest. But then cardiac arrest could also be as a result of other things. It could just happen suddenly because the heart is not functioning properly. The electrical system of the heart has gone haywire. It could also be because of congenital problems. Some kids are born with some kind of issues of their heart that kind of predisposes them to having having cardiac arrest. Also, sometimes trauma. That's why it's advisable that schools teach CPR. Accidents, yes. Trauma, chest, when someone hits their chest or something hits their chest, maybe in football or soccer, a child could go into having a cardiac arrest.
Just from a ball hitting the chest?
Yes. I mean, no, like an impact. Okay. It could be, if the ball is forceful enough, maybe, but most of the time is an impact. Maybe shoulder to shoulder or held on chest.
How about when somebody has almost drowned, for example? Is that necessary?
Yes. Drowning calls for CPR, because most times in drowning, the breathing has stopped and the heart is just barely there, barely working. Yes, you should go ahead and begin CPR.
Is CPR ever dangerous? Like maybe somebody who is asthmatic, for example, you know that person needs some medication. If the person goes unconscious, will CPR not make things worse?
Well, no, it wouldn't. In most cases with asthmatic crisis, the problem they have is actually respiratory arrest. They're not breathing well. And if you don't take care of that, their heart will stop functioning. So when you see someone that has gone into, having asthmatic attack, they are in desperate need of oxygen. If you begin to give them breath, mouth-to-mouth resuscitation, you are helping them. In as much as they should still go ahead and be seen by a medical professional, because what's happening in asthmatic crisis is the bronchioles are constricting. They need special medicine for that. But if you then go ahead and also give them mouth-to-mouth resuscitation, you are helping them. You're helping them.
Okay. Now, somebody is unconscious.
Yes.
He needs CPR.
Yes.
What is CPR?
Okay, CPR is...
Let's get this man.
Good.
No, where you are is
Yeah,
okay.
it's fine. Okay.
You can come back.
All right.
And his mouth is open. Okay.
Something fell up.
So what do we do? What do we do with the person? He's unconscious.
Okay, good.
He's not breathing.
Good. Okay. Two things. If you find them falling, okay, maybe I'm here talking to you now, I begin to exhibit signs of heart attack, and I eventually have cardiac arrest. There's oxygen fresh in my blood. Okay, now you can go ahead and give what is called hands-only CPR.
Okay.
The main aim of CPR, the most important part of CPR, is chest compressions, because we're trying to make sure that we get the blood flowing to the brain and other parts of the body.
And that's what the chest compression
does. Yes, because if you don't do that, after 4 minutes, the brain begins to die. And a few minutes after that, the person is actually legally, clinically dead.
So you can actually keep a person alive before the doctors come or before you get into the hospital.
Sure, that
could depend on you.
Yes, that is the function of CPR. So what we do first, if someone has fallen, you go ahead and tap their shoulders. Hey, are you okay? Are you responding? They're not responding. You check for breathing. Remember, when you're doing this...
How do you check for breathing?
You see, you can check
rise
their
and
chest,
fall.
it's not rising. You can put your head briefly around their nose. No oxygen is coming out. Okay, you go ahead and start your CPR. Okay, what you do, and then sometimes too, in addition, you could do what is called a sternum rub. You rub the chest with your knuckles.
Okay.
Rub it. If the person is just barely sleeping, this is going to wake them up, because sternum rub is painful. So you go ahead. In addition, you just want to be sure. Go ahead and rub the sternum. The person is not responding. Go ahead and start CPR. What is CPR? CPR is actually collection of compressions, in addition of giving breath, in addition of using the AED.
And the AED is?
The AED is automated external defibrillator.
Okay.
It is used to help to shock the heart back into normal working. Because when someone is having cardiac arrest, what is happening is the heart is just fluttering uselessly. The ventricle is just fluttering. So when you apply the pads with AED, the way I ask you to do is very layman friendly. Will tell you what to do. It's going to shock and deliver electricity to the heart muscles.
Okay, so what do you actually start with? The chest compression?
Sure.
Okay.
Okay.
Let's see how
so
that
what
goes.
you do is you just place your hands in between the nipples. Here, use the heel of your hand. Okay. You put your heel flat. I mean straight on here.
Okay.
No, right. This way. Okay. And then you interlock your hand. Good. And remember, the person must be on a hard surface. And you're going to kneel beside them, so that your weight is on their chest.
So you're going to use your weight to push.
About 2 inches deep. Okay? You go hard and fast. In American Heart Association, there's a music that we use in association to this. When you have the music playing in your head, it helps to keep the pace.
The rhythm.
Pace, yes, the rhythm. It's called hey, 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 staying alive, staying alive.
Okay, that song.
Hey, hey. So when you do that, automatically, you are going to go just
at that rate,
about 100 compressions a minute. But then when you break it down, you're actually doing 30 compressions before you give the breath. 30 compressions
then
to
the
breath. Yes.
How do you give the breath?
Okay. The breath is what you have to make sure is that we open up the airway.
Okay.
The airway has to be open. How do we do that? You tilt the head backwards a little bit with your hand. Maybe with it depends on if you're left-handed or right-handed. You tilt your head backwards just a little bit, then you pinch the nose short, okay, and then you tilt the head backwards, lifting the jaw on the bony part. You try not to do it here because you're going to close up the airway.
Okay.
So you go to the side, the bony part, okay, lift it up, and then give your breath.
You just blow into the
Yes,
mouth.
yes.
Blow into the
Yes.
mouth with the nose pinched.
Yes, with nose pinch, just to make sure that the air goes in. How are you going to know? You watch to make sure the chest or the abdomen is rising. If it's not rising,
so you blow,
reposition
it
again.
rises.
It
You
should
blow,
rise.
it rises.
That means the air is going in.
But if it doesn't rise, it means the air is not going in.
That means
is
you're
that
not doing
your
something
fault?
properly.
Okay, you're not doing something well.
It could be your fault. It could be because you're not positioning your hands properly. you know, you're not tilting the head good enough, or there could be something blocking it. For example, if you just came here and met someone falling, you don't know why they fell. It could be because they were choking, and you know, and they stop breathing, and then they pass out. So, but then the good part of it is, even if you don't know what's happening, and you begin to do CPR, the compressions on the chest is going to force that object out.
Okay.
That's
okay.
another thing.
So if he was choking, you do those compressions, the particle actually comes out.
It should come out. You can see it, and you can sweep it out.
Okay.
Okay. But then
now there's a little concern here.
yes, yes,
You are putting your mouth to his mouth.
yes, yes.
Some people wouldn't want that.
Yes.
And what of diseases?
Yes, that is a concern, okay? That's a huge concern. I understand that. But if we are talking about family members, you know, that's not going to be an issue, right?
Yes.
But if you are talking about someone on the street, you have issues. That's why American Heart Association, together with Savor Heart Center of Arizona, University of Arizona, in 2005 came up with a policy that says, yes, you can still go ahead and give hands-only CPR. Keep working on the chest. Keep working on the chest. Ambulance is on the way.
Okay.
Okay? Keep working on the chest, because what you're doing is you're making sure that you're circulating blood through the parts of the body. And especially if you have found someone that fell. But then luckily we have masks.
Do we have the mask here? I don't think we have it here. No. But what do you do with the mask? Do you put it over your face or over the face of the victim?
Over the face of the victim.
And that covers the mouth?
Yes, because it has a valve. Okay, the valve, when you put the mask on the face, the valve stays there in the mouth area, then you give your breath
through the
valve. And the valve is good. The good thing about the valve
Are you going to pinch over that mask?
No, you wouldn't. You wouldn't need to, because the mask is going to cover the nose.
Okay.
The mask is going to cover the nose.
That means you better do your business fast.
Fast, yes. You can even bend the bag. Cover the nose fast. Just do it fast, and then, you know, go ahead with it. But then, luckily now in America, they have these keychains. It's a smart thing. The keychains now have a mask, plastic mask in them. It's all rolled and squeezed up. So you're walking around with a keychain, but it actually has a mask in it.
And everybody can get to have that.
They're trying to make everyone get it.
Speaking of which, who should be doing CPR?
Everybody, from your gate man to your babysitter. Because your child could go into respiratory attack or in arrest, you know, and it could happen. It could be you having dinner and then you collapse. Your housemaid should be able to stand in and do something while ambulance is on the way. And especially here in our country where, you know, our response system is poor. That's even the reason why someone should be able to kick in and start working.
Okay, so this is all very nice.
Yes.
But when you've done your CPR, are there going to be emergency numbers one can call? Because, and at what point do you even call the emergency number? Before the CPR or after you've done the CPR?
If you are two people, assuming this is, you know, we're in an office, okay, you have your colleagues here and I fall out, you can start CPR when someone goes to call emergency number. But we know,
but of course in Lagos we can call 112. Yes, you can call 112 in Lagos.
Hopefully they'll get there. But I tell people, my own thing is, if there is a nearby hospital, when someone is on the way, put them there in the car and begin to work on them on the way. Yes. I mean, it's better than just doing nothing.
At what point do you use the defibrillator?
As soon as possible.
So you've done your 30 chest compressions.
Two breaths.
Continue
until the AED comes. But AED works better when the CPR has been started. It works better because that means the heart has enough blood in it for this to work. So the earlier you start the CPR, the earlier the AED comes, the better.
Okay, let's take a short break and then we'll go to other things.
Okay.
Please stay with us. It's becoming exciting. We'll be back in a minute.
Thank you. Amen.